Oh, being 415 pounds was a miserable, miserable way to live. You know, I always felt kind of like an outcast. I always felt like everyone was looking at me. I was always the fat one. I remember one time on the job I had to fly to Virginia Beach, and they had to get out the seatbelt extenders, and the flight attendant was none too happy about having to do that for me. And that was very embarrassing. You know, I've never cared a lot about looks or fashion, but living long is a great desire of mine. You know, when I decided to have this surgery, I thought, you know, this is my life, and I can take control of it, and I can change the way I look and the way I feel, and I can live the long life that I want to live. I decided to go to the bariatric seminar, and Dr. Woodman was the presenter. I called my husband up and I said, listen, I've got to go to Memphis tonight.
Obesity is occurring in epidemic proportions throughout the United States and the world, but even more specifically here in the Mid-South. There's no easy way to lose weight. Once somebody becomes at least 75 pounds overweight, which is a BMI of 35, that's severe obesity, and it's very difficult to lose weight without some type of help. Surgical weight loss is designed for patients once they have a BMI of 35 or more, usually with a comorbidity. That's when we can consider operating on somebody. There are exceptions, though, to the rule. As far as surgical solutions to weight loss, there's several that we offer, the primary ones being the lap band and the gastric sleeve procedure. We're also involved in some FDA trials, but suffice it to say, the lap band is the #1 procedure done volume-wise in America. I've done well over 3,000 bariatric procedures, and that includes gastric bypass, gastric sleeve surgery, and the lap band. What we try to do is to give patients the tools that they need to help themselves lose weight. They're all really designed to help the patients do the same thing, which is to be satisfied with less food. It's their job to do the rest. So just having surgery is not going to make somebody lose weight. Just about everybody that we see is unhealthy when they come in. Occasionally someone comes in and says they're just overweight, they don't have any medical problems associated with their weight, but of course most of them do, they just haven't been diagnosed yet. So the most rewarding part of the procedures for us is helping patients to be happier, healthier, and living fuller lives.
So if you find yourself like me and you're overweight, you're miserable, and you're not sure that you're going to live to see your children grow up, or even live to do all the things you want to do in life, I would really encourage you to seek out Dr. Woodman and let him do for you what he's done for me. My life is so different now. We go on family vacations, and I used to be the one who they would walk 5 feet in front of me, but now I'm the one that's running everywhere, and they're trying to keep up with me now, and I think that's cool.